Meeting to order, April 9th, Health and Human Services Board meeting. Roll call, please.
Deos Leader, excused. Kay Wilson,
Here.
Savitsky,
Here.
Mr. Van Etten,
Here.
Mr. Rusk, Mr. Trepanier, Ms. Pettit,
Here.
Ms. Pearson,
Here.
Ms. Dunlap. You have a quorum.
Can we have the Pledge of Allegiance, please?
Allegiance to the flag of the United States of America and to the republic for which it stands,
one
nation, under God, indivisible, with liberty and justice for all.
May I have certification of compliance with open meetings law?
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Any changes to the agenda for this evening? All right, public comments. Linda, would you like to speak now, or do you want to wait till the tourist rooming house section? Let's do that. Let's consider approval of the minutes from the previous meeting.
I'll make a motion to approve those minutes.
I'll second it.
We have a motion and a second. Any discussion? All in favor?
Aye.
Opposed? Thank you. LCO liaison. Do you have any information that you could?
No, I do not, other than our new health center is moving right along. Plans to open spring of 25. Other than that, I guess that's all I have.
All right. Senior Resource Center.
I got something emailed to me this afternoon, so let me find that. They are one of the top 5 organizations who've been nominated to receive the 100 Who Care Award, which is a $10,000 award. There's 100 members who have committed to donating $100 3 times a year to this organization, and then they choose their recipient. So they'll find out soon if they are approved for that. And then if they are, 70% of the meals that they serve are home delivered and 30% are congregates. So any funding from this is going to go towards the home delivered meals. They still have an opening for a cook in Stone Lake. Currently, Joey's working the breakfast in Stone Lake, Monday, Wednesday, and Friday. Their drivers bring Meals on Wheels and carryouts to Stone Lake from the Hayward to distribute. Barb Appleby retired as the nutrition director from the Stone Lake plan. They're not going to replace her. They're going to split her position between Joey and Jody. And then the wages that they're going to save there are going to go towards trying to bring Joey, Jody, and the cooks up to where they at least should be minimally. So that's where those are going. They have a pop-up meal option for lunch in June, July, and August, and possibly September. So if they do, then hopefully we can get that news out at the courthouse.
Thank you. Administration.
I don't have any specific reports, and looks like Andy doesn't either.
All right, that was easy. Adult long-term care.
Okay. Let me pull that up. Okay, last month we did talk about, I feel like I'm echoing. Last month we did talk about the additional funding that we were receiving as the North, the ADRC of the North, which was going to be split into additional positions to make sure that the phones were well serviced. So that has gone into place. We've done a little bit of transition with how our staffing is there to be able to meet those needs. And we'll continue to monitor that closely while we go through this transition. In February, we had 19 referrals for our information and assistance people, which then what they're doing with that is taking those referrals and assigning a specialist to give them options counseling and determine their options for care. And then a lot of those referrals that come in also have an APS component as well. So a lot of dual work that is happening. Our dementia care specialist will be training law enforcement in dementia education and dementia crisis in April. So they should be primed and ready to go with the Purple 2 project. Benefit specialist, the elder benefits specialist, just finished the general Medicare general enrollment period, which was January through March. And for adult protective services, we have 16 active open investigations since January. And then the other things that Carol has included was some of the support groups. And then last month, we did talk about the Purple Tube project. And so we did include a brochure so that you could have a little bit more detail on what that is.
That's true.
Does anybody have any questions? Okay.
Would you like to move on to behavioral health?
Sure. Get my agendas because I've flipped everything here.
Before we go on, can I just offer up one comment? I've had some questions the last couple months about ADRC versus Senior Resource Center
Okay.
and how does that relationship work? So we do have some relationship there. We do not have a contract with Senior Resource Center, but there is some funding and positions that essentially we share. But sometime in history, and I don't know the date, it's going back decades, Sawyer County opted not to operate the aging program, which is what Senior Resource Center does. And so when a county opts out of it, and I believe there's less than 10 in the state that have opted out, the state contracts with a nonprofit to deliver that service. So the state, which is GWAR, is the federal or the state agency that contracts with Senior Resource to deliver the aging programs. And so I just wanted, some people think that, we have some contract with them, and we really don't. We do supply them additional funding to do the congregate and home delivered meal program. This is essentially what we support, but otherwise they're supported by the state and federal funding.
Thank you for that explanation.
Okay. Moving on to behavioral health. I'll just give in the packet, we had the expense for services for 2024 included in the packet. You'll notice that we did receive some addition or funding from Winnebago that's kind of kicked back from last year. Sometimes we overpay and then they get funds that we then get reimbursed back. So that's what that is. But going into the behavioral health outpatient clinic report, over the last few months, we've talked about our therapy services and that we haven't had an additional therapist. But what we've done is work with Whole Life Services out of Spooner, and the owner, Gary Eckrick, is going to be coming into Sawyer County once a month to see clients with substance use disorders. So hopefully that will start in April if we have some clients ready to be seen. For our community or comprehensive community services, Northland Counseling is working on getting a second mental health therapist ready to go so that they are CCS certified. There are certain, when you're a mental health therapist, obviously you can provide therapy services, but with this particular program, you have to have a special certification that meets those needs. So we've got that happening. We have currently 3 clients in this program. For the coordinated services team, we have 9 clients in that program and no discharges or referrals at this time. In the Children Long-Term Care Support Program, that's the program that we have 46 clients in, and we have 3 new referrals. That's been a pretty heavily used program and continues to grow. So we are going to be watching that closely. One of the things that we've been talking about is really looking at our staff throughout the behavioral health area and how can we best use them to help support other programs when they get overly heavy versus the other programs. So really working through that. That is it for the behavioral health report. Anybody have any questions? Okay, then moving into CPF. We do have the report in there for the children in-care expense report was there. I will give you a verbal report on the rest of the things. For CPS, we've had in February 18 access reports received, meaning those were reports of referrals that came in for concerns with abuse or neglect. Of those reports, 5 were screened in and 13 were screened out. When reports are screened out, they're also referred to other resources as well. We currently have between Youth Justice and CPS, 28 youth or children who are in out-of-home care. For CPS, those 20 of those are through CPS. We have 16 that are in a foster home, 2 that are in a foster home that are relatives, and 2 that are in kinship. And kinship is a close to relative, but not a true blood relative. When it comes to youth justice, we have 8 kids that are actually that are out of home care right now. 3 of them are in Lincoln Hills, Mendota. So that is a high intensive area that also, if they have Mendota, they are getting mental health support as well. We have 2 in residential care, and we have 3 in a 180 program. And that's a secured facility through Eau Claire that we have those kids in. And again, as we've talked in the past, we've had some higher risk referrals that have come through, which is really causing us to be able to, or not be able to, but have to take kids out of the home and get them in an area where hopefully we can make some differences with them. Right now with youth justice as well, we have 31 total cases. And our new caseworkers, one has 13 and one has 16 cases. That's a really high caseload for a caseworker. So we're watching this really closely. We really don't have anybody to be shifting work to. So again, we might be talking about this in the future as well to see what we need to do to help support those services. Any questions on CPS or youth justice? Okay, we are moving into economic support. Shauna's here and she's actually going to speak to her report and give us a little bit of information on economic support services.
This on? So just the monthly report here. This is February information. For Sawyer County, we had 1,112 food share cases, 1,963 recipients, and that totaled 276,000, just a little over 276,000 in food share benefits issued. Badger Care Plus cases for Sawyer County, 1,512. And the elderly, blind, and disabled, we had 540 cases. Long-term care cases, 194. And then just some statistics on the Northern Income Maintenance Consortium. That's the consortium that we work with. It's 12 counties in the northern region here in the state. And so we operate a call center. Lots of phone calls in February, 8,675 calls for the month. We answered 95% of those. The longest wait time was just at an hour. That's usually on our long-term care or elderly, blind, and disabled line. Those calls take longer to work through. Food share applications, we had over 1,000. We processed 99% of those timely. Badger Care applications, 882 applications. Process those at 98.98% timely. Renewals processed. We had a lot of renewals in February, 3,219 renewals processed at 99%. And then the food share 6-month report forms, we received 570 of those and processed those at 98%. And then just looking at some of the changes here. For this year, we're still working through the unwinding of the public health emergency. So, starting in April, there are premiums again for Badger Care for children. So, lots of literature went out and publications about that starting up. And there's some conflict with the premiums. So it's a state law in Wisconsin that we charge for premiums when they're over a certain income threshold, but the federal government does not impose that. So premiums, members are getting letters stating that a premium is owed. However, if they don't pay the premium, we're not ending healthcare. We're not ending healthcare for any child that has been open for Badger Care. So it's a kind of a goodwill almost. If you can pay the premium, please do. If you don't, there's no repercussions. We don't come after you. There's no collections process. So it's a little confusing, I think, for members, but that's the update with Badger Care. I know with the MAP, that's a program that's for the elderly, blind, and disabled. Those individuals, we are thinking that those premiums will be put back in place in the fall. So just another piece of the unwinding. Of course, with the unwinding, this has had a huge impact on our staff. So the other document that is in your packet goes over a comparison from 2023 to 2024, just kind of comparing the month of February. So the number of calls that were taken in 23 versus where we are in 24. Longest wait. So you can see in 23, the longest call wait for the month of February was just a little over 34 minutes, and we're at an hour now. Just a huge increase in the workload. So additional funding was offered through the public health emergency. We're still utilizing some of those dollars and offering overtime to staff. It's not mandated overtime. Staff can work up to 50 hours per week, just trying to keep up with this workload. We also are utilizing 2 economic support staff from the Division of Human Services pool that they offered. And we've had the same 2 since we brought them in. And hopefully, if we have openings within the consortium, I know that currently we have openings in Ashland and Bayfield. Forest County also has openings. There's an opportunity here for economic support staff to work remotely. I know one of these workers that we have in the pool is actually from Douglas County, so we're hoping that maybe she will apply for one of our positions and we can have this well-trained person become part of our staff. So that's an update.
Thank you.
Any questions for Shauna?
Sean, if they don't pay the premium, can the provider still collect on the visit through Badger Care?
Yep.
Okay.
Thank you, Shauna.
Thank you.
Okay, now we have public health, and I believe Julie's here. She can step forward and we'll get the public health report, and then we can get open comment from Linda and then go into the piece. Okay.
Julie McCullum, Public Health. I just have a couple of updates since I submitted the written report. We did have another respiratory report, and the northern region is now in moderate levels for influenza-like activity, or influenza-like illness, excuse me, but the state is remaining at low levels. Did want to highlight that the Community Speaks event is happening right now. In fact, I just recently left there and they had 165 participants, not including the vendors or the workers there. So that was
Good.
good news. Wanted to highlight that National Public Health Week was last week, April 1st through 7th. and its purpose is to raise awareness, support, and community engagement for public health efforts. Did also want to highlight measles. You may have heard about some increases in the news. In 2024 in the US, we have a total of 113 cases reported by 18 jurisdictions as of April 4th. Currently, there are no cases in Wisconsin, although there are cases in surrounding states, including Minnesota, Illinois, and Michigan. Of the 113 cases, 58% have been hospitalized for isolation or for management of measles complications. 50% of those cases are under 5, so children under 5 years of age. Of our cases so far in 2024, 83% are in unvaccinated or unknown vaccination status individuals. 12% had 1 MMR and 5% had 2 MMRs. Any questions?
Where are the cases located?
So in 18 different jurisdictions in the United States. So when we say jurisdictions, they're looking at states.
Okay.
So the surrounding states in our region would be Minnesota. The most cases surrounding us are in the Chicagoland area. But there are also cases in Michigan as well.
Now I understand.
Ma'am, I got a question for her. What are the most prominent complications in a child like that with measles? Is it kidney? Is it?
Don't know.
Oh
I'll
my
have to
gosh, I
look.
have to relook it up. You're
Yeah.
making,
I can't.
making my mind.
Yeah,
I remember there are some serious complications.
there
there can be. There can
Hearing.
be.
Isn't hearing one?
Yes.
It can be, yeah.
Yes.
High fever, right? Julia can help me here with.
Yeah, it's common to have the ear infections and diarrhea along with it. And then the serious complications are pneumonia and encephalitis. So really the serious issues with the brain swelling.
Yes. Thank you.
I feel like I was having to
Yeah,
get
I
ready
was
for
just-
NCLEX here.
There you go.
The other thing I just wanted to make note on, it fits with public health as well as behavioral health. I have forgotten to say that it is also Alcohol Awareness Month. So I think we'll be getting some things put out on our Facebook page too for the awareness.
Very good.
Anything
Thank you,
else for Julie?
Thank you.
Just, I was out at the Community Speaks event. Just want to compliment public health for their role in that, playing a significant role in the awareness campaign that's going on. And then also the interagency work between the different public health providers, LCO agencies and ours. It's good to see.
It was a great collaboration. And yeah, good to see everyone.
No, I wish I could have made it out there.
And I have one other comment, kind of tongue in cheek. If the next time you have brew pub training, I'd like to be invited.
Brew pub.
It's in the
And
report.
there are brew pub training in there.
There
Did I
was a
miss
brew
that?
pub training
Oh, that's
with
right.
licensure
I
of brew
signed off on
pubs.
that.
So that's a part of our licensure with our agent program. And there was a facility training up in Ashland that our staff attended. So good. Good. Thank you.
Our next discussion is on the tourist rooming house draft ordinance. Linda, would you like to speak before we?
Good evening, Linda Zilmer, resident of the Village of Birchwood and Edgewater property owner. And I wanted to follow up with the email that I sent out this morning requesting that, especially with the reorganization and possibly new leadership coming next week with the new county board, I think it would be helpful to have joint meetings of the Health and Human Services and zoning committees in order to go through the history of what the ad hoc committee did and take a look at the most recent version of the licensing ordinance. And my email went into more depth about there is work that needs to be done on the zoning side with this. And just even getting down to when the ad hoc committee was first presented with that licensing ordinance in February, there was a notification requirement of neighbors within 300 feet. That is similar to the statutory notification requirement in zoning for things like a rezone or conditional use permit. It was not arbitrary. And the committee went and reduced that to 100 feet. maybe because it was due to lack of awareness by the ad hoc committee members, but it is very easy for any county staff, possibly even the public, to pull up a map of an individual parcel, and the program can identify all the names and addresses of parcels within 300 feet. And that is something that can be provided, and it's not a burden, I don't think, to notify people within that distance. Also, I don't know if the public comments came forward from the last ad hoc committee meeting. I do think it's reasonable to discuss again having signage on the property. And whether it's through zoning or this committee, I will continue to bring forward examples from other counties, like I did with Eau Claire for both the zoning side of this and well, primarily the zoning side, because I think there is a role in I think Sawyer County should not just focus on the health and human service licensing side of it. Thank you.
Thank you. So Julia, we had a discussion that maybe Ginny was going to be here, but she's at another meeting. So would you like to give kind of a little history?
Yep. Ginny actually sent an email that has some information in it, so I can go ahead and read that. So Ginny Chebek was the chair of the ad hoc committee, and this is what she wrote us. The ad hoc committee was formed in 2023 with the direction of the county board to make a recommendation on how to regulate short-term rentals. The committee took a few positions early on based on information provided by HHS and zoning. Bullet number 1, it was not going to, the committee was not, or the ad hoc committee was not going to write an ordinance, but rather it would recommend the framework of an ordinance. It took into account the previous ordinance from 2017 that was repealed, and regulating occupancy based on state statutes was approved. So the committee reviewed several other Wisconsin town and county board ordinances and found a lot of synergy with the Marquette County ordinance. Public comment was also taken into consideration during the development process. After approving the recommendation, the committee took a break while the departments worked on the ordinance alongside with legal counsel. The committee came back to review the draft ordinance in detail in February and accepted the changes in March. That version continues to be updated as it is now in the hands of HHS and zoning committees. Several members of the committee would like to stay engaged in the process as it moves forward. There likely will be specific questions that she can help out with in the future that we can bring back to her. So what you have in front of you tonight is the ordinance that was recommended by the ad hoc committee to come forward now to HHS and to zoning committees. There are some blanks in there, and those blanks that you see in the document are for when we get to the final version of it and it goes into Muni Code, everything kind of changes, and that's what those kind of those sections or blanks are set aside for. There is a highlighted section related to parking on page 31. And that was updated from the original that we just had sent through. That was one of the requests from the ad hoc committee, is that we take a relook at the parking requirements, because what we had in there actually contradicted itself. So the language now should be accurate. In addition, in the packet from the ordinance, you also have an implementation of the new ordinance and what we would anticipate things to look like. So as we move forward, we're in the creation phase, and then our year starts July 1st with our lodging licenses. So we'll be in the education phase this year. And one of the things that we need to take in account of, if we should move forward with the ordinance, is a lot of people are booked out a year in advance. So if there are changes, that would be something that would be implemented the following year if the bookings had already occurred. And then the additional piece, 35 through the fiscal pieces here is information that the ad hoc committee had asked us to be pulled forward so that we would have a educational packet that anybody having a tourist rooming house would have this packet to have standard materials and be able to have materials to share. These are all still works in progress. And so that is where we're at tonight. Now, we need to really kind of have some discussion on what these next steps might look like, whether you have recommendations for changes, how you want to move forward with zoning and public hearing. And I'll kind of lean into Andy as he might have some other understanding if there are some other things that we should be focused in on tonight.
No, that pretty much summarizes where we're at. When this ad hoc committee was formed, it came up from the committee level through this board as well as the zoning committee, and requesting the county board and the chair to make an ad hoc committee. So the ad hoc committee has referred the ordinance now back down to those committees. As it's been discussed, this is a health and human services ordinance, not a zoning ordinance. So for the most part, we envision that this committee is going to be essentially in the driver's seat as far as the timeline and having a public hearing. Zoning committee is also going to review it because there are elements of zoning that are affected in here, but it is intended to be a health human services ordinance. And what its intent is, right now, we operate as an agent of the state to issue the state licensure for accommodations. This would be like a piggyback of a county permit that the property would also obtain, intended to be seamless, that, they would provide all that information and our public health staff would issue a state permit and a county permit. As far as process, I think because of some ordinances, when we adopt or amend, they go through the committee. We have a public comment period in the committee meeting. I think because of the nature of this ordinance and the interest in it and how it crosses over a couple different departments, and then we know there's interest from the proprietors of these establishments as well as town residents, neighbors. We proposed that there be one public hearing just for this ordinance that be set for gathering the public input before it would go back to the committee for any changes and then to the county board for adoption.
Ginny and I sat down one day and went through this proposal, and there were a couple of things that we came up with, and one was under 14.4.12D under pets. We thought that perhaps the ordinance 4.2.10 and 4.2.11 should be included in your packet of information so that the owner would have the actual rules and they wouldn't have to try to go back and look it up because they won't. And so if that was delineated maybe in the educational packet, that might be a good idea. And then also in 14.4.13F.
Which one is it?
14.4.13.
Okay.
F.
Want to make sure.
That is calls for service.
Mhm.
And I thought it was important that the owner be notified for any call for service as a resort owner and also a tourist rooming house owner. If somebody was being naughty or acting out, I would want to know about it.
Mhm.
If the sheriff or the human services got a notice, because if my guests are acting out, they wouldn't be welcome to come back. So I would want to know about it. So I think that might close a communication loop if we had that recommendation in there as well.
Okay.
Tweed?
Yeah, thank you. Andy, what changes were made at the last ad hoc meeting? Because I missed that meeting, but I was at the previous one and we were really close. but they wanted one more kick at the can and then it came back. Is that where the 300 feet was changed?
Yes.
That was one of the things.
That's what I thought.
I don't know if Julie has, I don't have a list of those specific changes with me.
What about the distance that the owner or the delegate lived or had to be away from the property?
That's still 60, I believe,
60.
60
minutes
minutes? Got it.
to be able to respond.
Yep. And what legal counsel agreed with this?
Legal counsel was heavily,
I know they were involved, but I mean, they're good with this.
yes.
Yes.
Why was it changed to 100 rather than 300 feet? 100 is just your next door neighbor.
Yeah, so one of the things as we we're looking and trying to make sure that the language fit so that it was really clear that it was that neighbor right next. So everybody who's abutting up to your line, it would get you across the street as well. And it should get you across any major roads. That was the one thing that they were looking at. The other thing that as they were looking through it is it does, if you just think of a normal lake property or housing, it seems like, oh yeah, then 300 feet should be fine. It is from the perimeter, but there are some areas where it's going to be a lot of connections because of all like the condo associations that are all within, so the entire building and whatnot would be. So just based on some recommendations on what that would look like, because zoning does have to put that together and do those notifications right now. As we look through, felt that 100 would get you to your next door neighbors so that everybody would be able to respond. And that's why that was changed to 100. That was a recommendation that had come through. And I was looking. I'll see if I can find that other one, Tweed, that had the old changes in it. Oh, okay. You want to come up and if you can remember some stuff and I'll try to find.
So I think that there was some issues with bedroom definition, given the fact that throughout the document, we were using the POUTS definition of bedroom. So we just wanted to clarify that versus the SPSS or SP. Maybe you can, the other, there are several definitions of bedroom, right, in code, but we opted to use the POUTS definition throughout the document. So I think that there was some discrepancy there. Calls for service was also edited for clarity. Parking was edited from that meeting to the next meeting.
I'm just paging through to find what was highlighted.
Andy, do you expect the public hearing to be at the committee level or the county board level?
I would suggest at the committee level because you want to have an opportunity. I mean, certainly the county board's invited and encouraged because I think it's going to be that big of an issue to gain knowledge of it. But you're going to want to be able to take it back to the committee after the public hearing to make any adjustments based on what you hear. And I should just maybe offer to, we didn't intend to come in here tonight to give you a in-depth breakdown of the ordinance because we know this is this board's last meeting. So
Gotcha.
we know we have a job to educate
The next board.
the next Human Services Board on this.
The other thing that was changed in there was really looking at the POUTS definition of what occupancy would be. So it would be based on whether they had a POUTS system, it would be 2 persons per bedroom. And then if any other technologies, methods, or wastewater design flow estimates approved by the Wisconsin Department of Safety and Professional Services. So it gives people that option if there were some other methods of being able to determine what would be reasonable wastewater for their design, they would be able to do that and increase their occupancy. And again, that would be, we would push that off to DSPS for those decisions. Let me see if there was anything else. We left it at the 60 minutes for the response. That was one of the things that was asked about. Owner obligations, we did, we changed it to be an owner shall be responsible for the conduct of each person using a tourist rooming house property. What was crossed out was an owner shall be jointly and severely liable for payment of any penalty or forfeiture incurred by the renter or person using or occupying the tourist rooming house property, and any unpaid penalty for forfeiture shall be included in the tax roll for the tourist rooming house if not paid within 6 months. So that language was taken out, and we just said that the owner is responsible for the conduct that occurs at the property. And
Reasonable response.
and yes, and then there's another section that we said that instead of talking about each individual complaint and what kind of complaint it is, we made it a little bit more generic so that we were asking owners to respond within a reasonable, well, the owner shall take reasonable measures to respond to any complaint. Reasonable measures from it, depending on what it is. It could be responding the next day, having a conversation, could be calling law enforcement and having them come out to assess what's going on. So. There's a lot to these.
Who's going to be responsible for resolving the complaints?
The owner is going to be responsible for resolving the complaint with whoever is making the complaint. However, it'll depend on what type of complaint that is, right? If law enforcement gets involved, it's a legal situation. We will, because of the way we're hoping to have this set up, at this point, law enforcement does not necessarily know that it's a tourist rooming house that they're responding to. So one of the things that we're hoping to be able to do or expecting to be able to do is to be able to put everything into GIS tracking so that when something does come into dispatch and they open that up, they'll be able to see if it's a tourist rooming house or not. Now, that doesn't necessarily mean that there's a renter there at the time, but it does at least give additional information to law enforcement, and then that way they can reply back to us or HSHS or HHS, knowing so that we would know that a complaint occurred, and then we can get that back to the owner and close the loop. If that makes sense. Now, this is it's more work.
Yeah.
Is that what you're going to say, Andy?
No, I was just gonna continue on so that you're aware. So, I mean, that's on a daily basis, all the complaints get resolved. Like, as you note in here, there's the calls for service and the number of calls triggers some action. If the health officer determines that a license is suspended or terminated and the property owner wants to appeal that, this board is the appeal
Oh,
board
yes.
for those decisions.
We need to remember that probably, it is about 10% of the tourist rooming houses that it's not like we have 80% that we get complaints on all the time. So it is a smaller number, and we hope that by having some of these guidelines and information in this ordinance, that we kind of get everybody funneled and working in a direction that will eliminate some of those things. But we don't want to have to, well, I'm not the health officer, but I don't think we want to have to remove anybody's licenses. What we want to make sure is that we are good neighbors and that we're providing safe and secure places for our tourists to come and stay.
And just as we move this forward, I don't think I'm speaking out of turn here, that through the process, well, leading into the ad hoc committee, and the ad hoc committee has had public comment at their meetings. They've heard from some very impassioned neighbors, very impassioned TRH property owners and managers. And I think they've tried to take into account some of those things they've heard feedback from. We've heard from attorneys on behalf of tourist rooming house owners that have provided, I would actually say, some constructive feedback on our ordinance, and the attorneys have talked. So, I mean, this is going to be a process to get it, get to the ending with whatever we adopt. But yeah, there's definitely a fair amount of opinions out there.
Andy, was this draft or version better received by those parties? Would you say?
I'm not going to answer that. I don't know.
I would say it's getting better and better over time.
And I mean, we're not doing this in the vacuum either, as it's been pointed out. There's review going on at the state level with DATCAP, administrative code that deals with this. And we're obviously not the only county that's going through a similar process of looking at how to address tourist rooming houses. I think the explosion or the rapid increase in numbers of rooming houses is outpaced anybody's anticipated rules or management of them. So I think everybody's trying to play catch up on it right now.
I think about enforcement of the number of people, the occupancy. I saw a recent ad for a tourist rooming house in Lake Chautauqua. It had 8 bedrooms and it advertised an occupancy of 28.
So using the current way that we would license, I don't know the facility, but I'm just say that it may fit our licensing with what we could say could sleep there, depending on what the spaces are, egress and open square feet, because it isn't a true bedroom that we would be looking at for a tourist rooming house when we use the state, the agent licensing. And really, that does not take into consideration if there's a POUT system and what that additional people would be within that system, which is why as we work through this with the ad hoc committee, we took into account what that would look like if they had a POUT system, and then base that on what residential would be. The other thing that you will note in here, there are quite a few places that say as amended to just kind of piggyback in on what Andy was stating. We do know that the state is looking at a few of these different areas. And we just want to make sure that as they do make those amendments, that then our ordinance would just fall into place.
So when a person gets their license, will it say the occupancy?
The occupancy, yeah, and it already is. So internally, they know what their occupancy should be. And then the other thing that we have in place is a web program or software program that actually goes out and looks at these marketplaces. So Airbnb, Facebook is what, or Facebook. Verbal is what I mean by that. And it will screen those. And then that's how we do find places that are advertising that don't have a license. But it's also how we're able to identify what they're advertising for and if they're advertising over their allowed licensing. So there are some checks and balances that are already happening, but those are pieces that I would say don't happen as consistently. It's, we get those ebbs and flows in the time that we're able to work on those things. So it is something that we'll have to take into consideration as we move forward with an ordinance that would have more things in place.
Yeah, I think that's from the administration standpoint, that's something we've discussed with zoning and public health is, there were a few different ways probably we could have tackled the ordinance. It ended up coming out as a health and human services ordinance through public health. Part of that, and I think part of the ad hoc committees, what they kept in mind too is what's reasonable enforcement going to be. We know there are other areas that have a lot more rules and requirements in there. Some of those things have been weeded out just from the practicality of how do you enforce that. But that's something, as administration and as the board, I can tell you, we're probably gonna have to have that conversation when we get further into this as to, what does the staff time take? We're probably not keeping up now with 600 of these properties as well as what we have going on in zoning. We're probably gonna need to talk about how to manage it. And I don't want to use the word enforce because I don't want to come off as being penal. Because I think if you see the implementation timeline, we're allowing a fairly long road to educate and kind of build that in so that it is reasonable and not too cumbersome for the property owners. But that is when you ask about enforcement, that's going to be kind of a work in progress.
So what is the next step? The zoning committee is going to discuss this as well?
They're going to have a similar conversation to what we're having because they too are going to be turning over. So I think what we're recommending is that a public hearing date, whether you want to set one or ask us to set one, be held probably in May after the committee meetings. So that
Is this like a class 1 notification, 30 days?
yeah, it doesn't have to be because it's not a zoning ordinance, but yes, we want to put out a public notice so that it's well known that we're having a public hearing on this ordinance. But I think we'd want to have at least one meeting to educate each of the new committees before we get to the public hearing.
Any other questions? Comments? Thank you.
So do we want to be able to set that, or do we need a motion to
Yeah.
the public hearing? I'm
Are you okay with staff setting a date in May? Otherwise, we have to wait for because we want to do publish a notice for it.
What's the hurry if, even if we pass all this, it's not gonna go into effect till next year? So why don't we just wait until the new chair is set and the new committee members are on?
and next month, and then make a motion to set a public hearing.
I think
Is that what I'm hearing? I just want to make sure I understand.
Yeah, I think that's what,
I think that would be appropriate myself.
okay.
Do we need a motion for that?
Mm-mm.
Okay,
We'll bring it for, what I'll do is I'll put it on the agenda and bring it forward.
okay.
And then that way, we want to make sure we get the public comments, while it's still fresh to
Are you
go.
all right with that? Dawn, are you all right with that, Dawn?
Yes, ma'am.
Okay, all right, so,
We'll wait until next week. We'll put it back onto the agenda, next
Yeah.
month, get it back on the agenda, with some of the same information.
and maybe more because the zoning committee will also.
And
have-
zoning will have met, so we
Yeah.
can bring forward whatever they had to
Great.
discuss. Any other questions? I know it's a loaded document to work on. One that's been long coming. Okay, would you like me to just move through the agenda?
Yes, please.
Okay,
We have
for.
budget performance report?
Yeah, so we're on the budget performance reports. Again, it's really early in 2024. So we do have each of the reports in front of you and the receipt recap along with the purchase services. The only thing that I would say that I am keeping an eye on at this point, which I've already made note of, is the youth justice. I believe at this point, we're having more out-of-home placements than we had anticipated for. But again, it's early in the year and that could ebb and flow as we go through. So just something to keep our eye on. Otherwise, I don't have anything else within the budget to make note of.
Any questions, comments? Purchase services recap report?
Yep, I kind of just spoke to all of those.
Okay,
Yep,
all of
the
that?
purchase services is where I would be most concerned with. The other, actually, there is one other piece that I just, now that you mentioned that again, is transport. We are having transport services that are costing anywhere between $1,100 to $1,700 to get people to secured transport. That's both for youth justice, where we have to have them sent, and or for mental health commitments where they need to be sent down and we don't have law enforcement that's able to bring them at that particular time. So we're having to contract out for those services. So we're going to be continuing to look at that because that is one of the expenses that could impact us as well.
Who else is qualified to do that transportation?
There are specific services that we can contract through for secured transport. There's 2 of them. None of them are located right here, so they have to come up. I always remember the old names and not the new ones, so maybe Talon, Marshall can help me with some of these names. Talon, and I always want to say Lackalow, but that's not the name of it. And then Potentially, we could be looking at an RFA or something else where maybe we could get somebody who might want to put out that they could do secured transport for a certain amount of dollars for contracted services that would be less than what we're paying for these other transport services. So something that we definitely have that we need to be thinking about if this continues.
Our current, protocol is that when we have a transport, adult or youth, we contact the sheriff's department and if they have staff available to do the transport, they will do that. They'll even use the city of Hayward or city of Hayward will provide transport in lieu of the sheriff's department. But if that's not available, then we still let them make the call on the agency that'll do the transport for us.
So you'll start seeing that on I know that's going to pop out for you on our purchase services. So
We added that so we can track that
yes.
better.
Do we have any future agenda items that anyone would like to add? Or talk about? You?
I think it's all going to be about
Is there
the
any,
new board.
is there any correspondence or reports from conferences that we?
I think everybody who has had anything, you just had people that had gotten training. We do have Sarah who is at training, so for youth justice and child protective services. So we should hear about that potentially next month. Boy, I want us to meet next week, apparently. I keep saying that.
Well, with that, I'll call this meeting adjourned.
Okay, thank you.
Thank you.